Hi, this is a quick tutorial for your WWCC Nursing Assistant clinical research project. This research project is designed to help the CNA or CNA student understand why certain care is being done on the resident or residents at a nursing home facility. But this also can be applied to any other aspect in medical community, whether it be hospital, OB unit, OR, down to a medical office. And so just think of it that way, that it is a broad thing, that each individual patient has a plan of care. And we develop the plan of care for that resident or patient or client because of their disease processes or what is needed for them to succeed or become better. So just want to quickly go over first, if you look over on this first one, this is during clinical, we have a certain schedule we're going to be following. At 5:30, you do need to arrive, and then at 5:30 to 6:30, we're going to do a tour. That's just going to be a quick thing around the facility to show you what is going to go, where everything is. And then from 6:30 to 8:30, we really have to have all vital signs done by 8:30 or before. So you can't be slow about it. Usually each group will have 5 to 10 vital signs to do. You will be paired up with another student. You can choose that group, or the instructor might choose that group for you. We will assign vital signs to you, and as you get them done, we will write them down and check over your vital signs before they're entered into the chart of the residents. Those residents that you're doing vital signs will not be the residents you're taking care of for the day. Those are just going to be the ones you're taking vital signs on. Then, as you guys finish up in groups, each group will be paired with a CNA, whether it be a bath CNA, a CNA that's in the dining room, CNAs that are on the floor, or maybe even the restorative CNAs or physical therapists. So, depending on what is needed and where help is needed, and plus what direction the instructor would like to put you guys in, that's where you're going to be. And we're going to try and rotate every hour, hour and a half. So between 8:30 to 11:30, you'll be on the floor doing care, doing baths, helping answer call lights, changing oxygen tanks, helping with lifts and transfers, and anything else the CNA might think is helpful for you to learn. Remember, you need to jump in and you need to follow the direction from the staff CNA or the other nurses that are helping you. Please try to ask questions. Again, jump in. That's the time you're going to practice your skills and utilize all that knowledge you've learned in lab and in theory. Around 11:30, we're going to get off the floor and start a research project. You will need to print that off, so make sure you have done so. During that, we will talk about residents and what is needed for this research project. Usually we do that till about 1:30 and then do a post-clinical, talk about our day, and then after that we will leave. So we do finish the day around 2:30. Over here on this slide, this is our research project. The instructor will group you up or give individualized residents to each group or individual. So just be aware, you might be in a group, you might not. It just depends on what the need is at that time. She'll give you the information here, the resident, room number, and some diagnoses that that resident has. It's going to be your job to do the rest of the research and decide what diagnosis you want to do as a quick kind of project at the end of the day. So you might need to look at the care plan notes, which she should have printed out, or if we have access to the computer, you'll be looking there. Or you might be looking at the actual charts to gather some of this information. Sometimes you can just go and talk to the resident or staff members, CNAs, nurses, to gather some of this information also. But you're going to fill in needs, the resident's needs for the ADL. So how do they get ready for the day? Do they have to have someone brush their hair? Do they not? How do they transfer? How do they toilet? Are they incontinent? Are they on scheduled toileting? Any other special social needs? That's their family. Do they attend activities? Do they go to church? Do they like to sit at a special table in the dining room? Dietary needs, what kind of diet are they on? What kind of fluids are they on? Stuff like that. And then other notes that you think are useful. Also, I want you to get used to interviewing a resident. You don't have to word these exactly like this when you're interviewing a resident. So when you're doing an interview, you might want to read ahead, think about how you would word these so you can have a rapport with your resident. So what I need to know to give you the best care? And you don't have to word it that way, but it's nice. What do I need to know? So I provide the best care for you. Is there anything that we could change in your current care to make it better? And how do you feel initially when you moved to CRCC? Other questions, how has your feelings changed? What's your favorite thing about living here? Maybe discuss the family, how many children they have, are you married, where did you grow up, and etc. You can interview and ask as many questions as possible. These are just a quick outline for you. Other ones, sometimes the student doesn't feel like they have that rapport, so you don't have to ask these, but they're very good at getting used to that awkward questions that you do have to ask when you're working. Like, what losses have they experienced? Maybe friends, family, kids, husband, maybe even eyesight, hearing, etc. And what those losses has it affected, like their care. Also, put yourself in the resident's shoe. Do you feel like you would have the same experience if you were dealing with the losses? How do they cope? What coping mechanisms do they use to help them get through every day? Then you're going to take all that information that you've gathered, and you or your group are going to develop a 24-hour plan of care. What time that's taken in, what time do they get up, what time do they eat snacks, and I don't want just like a quick note. I want you to put, resident gets up at 6 a.m. She needs assistance with brushing teeth and brushing hair, but she puts on her own shoes and socks. At 7 o'clock, she eats breakfast. She needs set up with her breakfast, and so on and so forth, going through the whole day, like if you were taking care of her or him. Then, at the very beginning, one of the diagnoses that the instructor has given you, you're going to take one of those diagnoses and make sure you report that to the instructor so she knows and doesn't overlap diagnoses with the students. So take one of those and do a simple overview presentation for your classmates. So you're going to just choose that overview and facts about the diagnosis, symptoms and other types, diagnosis and tests that help determine that they have that disease process. What's the treatment and cure? How do you live and manage it? Is there any support and resources available? And any other information that might be helpful. You do need to have some kind of presentation because all of us learn differently. So whether you put it on a big poster board or do a display board, you can even put it on a computer and put your laptop in the middle of the room for everyone to see. You can be creative with this. You can even make handouts and flyers and stuff like that. So be creative when you do that. This right here is just an easy sheet, so you know if they're independent, just so when you're doing your presentation. Okay. And the last part of the presentation, you're going to take all this information and tell us how that affects your, and why and how that affects your patient's ADLs. Is it because she has congestive heart failure? That's why she is on a low sodium diet, for instance. So you're going to tie that diagnosis with her plan of care, and that makes it individualized. So hopefully this helps, and we will go over more of this in clinical. And if you have any questions, please talk to your instructor.